Ma'am, can we start?
Let's start. Yes,
Yeah.
yes.
Oh,
Very good afternoon, everyone. On behalf of the IIP Digital team, I, Dr. Manisha Tarpalikar, welcome all of you for today's webinar. On the occasion of the Foundation Day of IPWC, which falls on the 8th of August, the IIPWC Andhra Pradesh team has organized this theme webinar as a pre-conference event. The topic of today's webinar is Trauma of Deprivation and Distress on Geriatrics Post-Pandemic. Our speaker today is Dr. M.V.Raju, who is a senior professor and head of the psychology department in the Andhra University. Dr. Priyalini Shankar, Dr. Diptiraj Malela, and Dr. Monica Sunkara will be the moderators for this session. Dr. Alopi would be co-hosting this session along with me. We are live streaming on the official IIP India YouTube channel. I request all participants to subscribe to the IIP India YouTube channel to get regular updates of our webinars and attend the upcoming webinars as well. If the participants have any questions, kindly leave it in the chat box. These will be answered at the end of the webinar. I now request Dr. Priyalini to kindly take over. Thank you.
um, thank you so much, Dr. Alopi and Dr. Manisha, for joining us today from the IAP Digital team. And good afternoon, everyone. I'm Dr. Priyalini Sarkar, the State Coordinator of IAPWC Andhra Pradesh. It is indeed a moment of pleasure and joy for us to be a part of this IAPWC Foundation Day celebrations. It's all about women power all the time. And we being a part of it and hosting a pre-event with the theme geriatrics. South Zone is given the theme of geriatrics. And the topic is trauma of deprivation and distress on geriatrics post-COVID. This will be taken by Dr. M.V.R.Raju sir, who is a senior professor and he heads the Department of Psychology in the Andhra University, which is one of the biggest universities in Andhra Pradesh itself. And before we get into the details, I would like to thank Dr. Ruchi Vaishnav ma'am, the national head of IAPWC, for bringing all the women together under one roof and giving us the freedom to organize these events, these webinars, which are very meaningful and also successful. And hearty welcome to our South Zonal head, who is very new to her post and is also one of the person from Andhra Pradesh itself, Dr. MC Jayaprabha ma'am. It's an honor to have her here with us today. Hearty welcome to the team, ma'am. And with this, I hand over the baton to Dr. Monica and also Dr. Deepthi, who will be doing the moderator job for today along with me. And everyone, geriatrics, as we all know, is a subject about elderly. As much as the youngsters, as much as the children are coping up with COVID, it's a given that the elderly people are suffering a lot emotionally, physically, and financially also. And it's time that we actually take a note of how to make them feel better, because every house has an elder who suffered from COVID. And let's make their lives better by getting to know what is the trauma they are going through and how we can cope up with through this webinar. And thank you so much once again, Dr. Raju sir, for coming up with a wonderful topic. And Monica, it's all over to you to introduce the speaker.
Good afternoon, everyone. Myself, Dr. Monica Sunkara, IAPWC APT. On behalf of IAPWC APT, a very warm welcome to you all. On the occasion of IAPWC Foundation Day, we, the IAPWC AP team, is conducting this webinar on the topic Trauma of Deprivation and Distress on Geriatric Post-COVID. I would like to thank Dr. Ruchi Vaishnav ma'am, the National Head of IAPWC, for giving us such a wonderful platform. My hearty welcome to Dr. MC Jayaprabha ma'am, the South Zonal Head of IAPWC. I heartily welcome the speaker of the day, Dr. M.V.R.Raju sir, the Senior Professor and Head of the Psychology Department in Andhra Pradesh. We are honored to have such a wonderful and experienced person to deliver amazing message on the theme geriatrics. He has 35 years of teaching and research experience. He has books. He received many prestigious awards. He presented research papers in more than 92 national and international conferences and 114 research papers published in reputed national and international journals. He also organized 22 national and international conferences and workshops in the area of applied psychology. Now I would like to invite Dr. M.V.R.Raju sir to give us a brief note and beautiful insights on the topic related to geriatrics. Over to you, sir.
Yeah, good afternoon, my dear participants. Most respected Dr. Ruchivarshini, Dr. Priyalini Sarkar, Dr. Mercy Prabha, Dr. Monica, and other the members of IAP here in India. It's my privilege to share my research and clinical experience with regard to trauma of deprivation and distress on geriatrics post-COVID. See, before I discuss geriatrics COVID, very briefly, I will explain a small picture, ageism and stereotypes. You see the picture? We can control our appearance and health through exercise, pills, and beauty products. Nola, age 95, her granddaughter, age 21. Her name is Alexandra. See the difference between Nola age 95, granddaughter age 21. Were in the same graduating class at Fort Hays State University in Kansas. See here, very interesting thing I will tell you, my dear participants. The external beautiness and internal beautiness is more important. We are aware when we see our internal beautiness through our mirror. The mirror tells where we are. With the support and help of the mirror, we are correcting our beautiness with different creams, powder, etc. But majority of the people in the society not seeing, not aware their internal beautiness. That's why they are moving into aging. What do you mean your internal beautiness? Our internal beautiness is here, your ability, your knowledge, your learning, your thinking, your communication skills, your motivation, your cognition, your creativity, reasoning, and stress coping. Those who are known their internal beautiness, according to gerontology research, no doubt we will moving to 110, 120, 130, and also according to gerontology psychology speaks, by 2025, aging moves into 140. When is the old? When is the old? people feel middle-aged or old depends on number of factors, including personality. The personality includes your attitude, your aptitude, your learning, your thinking, your emotions, your reasoning, creativity, logical reasoning, decision making, and so on, is one of the important factors. Number two, social status. This is also very, very important. Wherever we work, that is social status, irrespective of low, middle, and high status. And everybody is equal. The way we see, the way we think, the way we analyze, it depends on your social status. Number three, health. This is very important. Health is also more important. The health is also, before talking about physical health, mental health is more important. This mental health is mainly depending on the stress. Those who are aware of their own stress, the stress means pressure or a strain. For example, the pressure increases, it leads to bad stress. The bad stress people lifespan 65 or 60. Those who are having good stress, they live longer, 100 plus. That is called as mental health. This mental health leads to physical health with different philosophical problems. We will discuss the later. Coming into how we feel. Society usually defines old in chronological age. That we call it as age. When we coming into late adulthood, normally lifespan development in psychology, the age starts and the baby coming from mother womb till death, we have different stages is there. The last stage is late adulthood. Late adulthood is 65 years. According to WHO, Indian lifespan 65. Very recently, since last 1.5 years, Indian lifespan increased in 65 to 67. When we're coming into developing countries lifespan, 85. Now 85 to the increase, 87 and 90. So here is characterized by great changes and ongoing personal development. The older adults face profound physical, cognitive, and social changes. You can easily notice our physical changes. And also, when you're talking about the cognition development, the thinking level, our memory level reduced. But today, according to WHO, the second highest disease in the world, depression. In India, in the first place. So here, when talking about the cognitive development or cognition in old days, but today people started Alzheimer's diseases. and social changes. And coming into old age used to be equated with the loss. What do you mean the loss? One is brain cells, intellectual capabilities, energy, and sex drive. The psychology speaks every human being need, including animals and the birds. The physiological needs are very, very important. Number two, secondary needs are very important. So here, those who are not satisfied the physiological needs and secondary needs, definitely you will see loss of brain cells. And also intellectual capabilities decrease. But today, at the age of 60, 70, 80, intellectual capabilities are increasing. 40, 40 plus, 50, 50 plus. When we enter into the 60, those who are having good learning skills, you will see the real emotional IQ. That's why today, majority of the Nobel laureates is above 70, above 80. Until till today, majority of the writers, they start writing 50s, 60s, 70s, and 80s. But today, due to because of the stress, intellectual capabilities are decreasing. Energy levels are decreasing. And sex drive is also reduced. But sex is also one of the important biological need. But due to because of the stress, the sex drive is also reduced. Coming into the physical development in late adulthood, 60 to 74 years, old are 75 and 84. The oldest, 85 above. Now, very interesting, the research findings. I will explain, my dear participants. %50 is based on lifestyle. 50% is based on lifestyle. 30% on genes. 20% on other factors, especially social class. Just very briefly, I'll explain. What do you mean the lifestyle? The way we live, the way we think, the way we understanding ourselves, the way we understanding others, the way we behave, the way we behaving others, and also see our attitudes, see our emotions, and also lifestyle. How many hours are we sleeping? 6 hours sound sleep is more important. But the older people need more than 6 up to 8 hours is very, very important. So today, according to neuropsychologists, neurology speaks among every 3 persons suffering, 1 person, among 3, 1 suffering with sleeping problems in our country. Not only that, the way we eat means the balanced diet, the type of food or quality of food. our living conditions, the way we enjoy the life. And another interesting thing, the lifestyle smile is more important. As soon as we wake up in the morning, till getting the sleep, the minimum lip smile is more important. Wherever you go, wherever you sit, wherever you walk, and while you're starting the work or reading the book, minimum lip smile is more important. Lifestyle, 50%. The 30% the genes. And the genes is coming from hereditary, either mother side, the father side, minimum 3 or 4 or 5 generations. 20% other factors. What are the other factors influencing in our physical? Here, I'm talking about in India. In India, the caste system, the religion, region problems, language problems, and wherever you work, any institutions or industries, superior subordinates and peer problems. And also, according to my research, more than 86% of the wife and husbands are not comfortably living their respective home. They are criticizing each other, or abusing each other, or sometimes beating each other. What I have seen in my clinic, rarely we'll see true interpersonal relations, love, and the friendship. These are all we call it as other factors. We can't change our genes. We can't change our genes. But according to science, we have rigorous research is going on all over the world. But genes cannot change, but may change. Intercaste marriages, interreligion marriages, interstate marriages, and inter-country. So when we have changing our marriage system, not within our own caste, our own religion, our own relatives, the possibilities is there. Genes changes possibilities is there. We have to see the research in these angles. Social class also can change. So wherever you see the changes, lifestyle or genes or other social factors, we can live longer. Can live longer according to gerontology psychologists by 2025. 135 to 40 years lifespan. And changing our lifestyle. Coming into, when you want to see a good physical health, the long life, for very similar reasons, we need unpolluted air, pure groundwater, a lean or 2 of red wine in Western countries. But in India, we need not take, to take. It's not necessary. It is not necessary. Take good fruit juice. Homegrown vegetables, daily naps, good genes, working all day. Sometimes some people is not to work at their office. That is also a stress. Little or more intermarriage with our outsiders. The strong family networks that provide financial, emotional, and social help throughout life and a daily glass. What gerontology speaks? The scientists who study the biological, psychological, and social aspects of aging emphasize that the aging population should not be lumped into one group. The percentage of old people is important in every society. Old people is very, very important in every society. You will see old people in Japan, the China, and developing countries. In India, very, very few aging people. But we are talking about the older people is important in our society. I want to tell you importance of older people in the society, especially in respect to families. In India, it's a great country. Ethics and moral values are excellent in those days, not now. Why? Because we had joint family system. Whenever we have joint family system in respect to a home, elder people live together, respecting elder people, obey, respect people, listen to what they say. When they have good interaction, they enjoy the food, they enjoy the walk, they live together, respect to home, sharing their happiness, sharing their unhappiness. It's a good outlet in joint family system. Not only that, they teach ethics and moral values. Ethics and moral values. Earlier, they taught at home and schools. Sumati Satkam, Vemana Satkam. It's a very, very important, ethically oriented the books. Now respect the state that today joint families are declining. That today majority of the people moving into nuclear family. Wife and husband, single child, or two children, rarely three children. The wife and husband moving for the earning money. They want money. They want social status. They want social class. But rarely we see happiness. And no time to spare the respect to children. When the father, the waking up, by the time the children moving to the school, the moving to the tuition. When the child coming back to home, finishing the homework, they had the dinner. By the time of sleep, the daddy is coming late. They will not see each other. But today, we will see this type of environment, or we will see today such type of society. My dear participants, we move into trauma. See here, what do you mean trauma? An emotional response to a terrible event. Emotional response to a terrible event like an accident, aeroplane accident, the train accident, the car accident, or two-wheeler accident, rape. Today, rape is also common in our society. There is no sensitivity in our society. We have very good laws, very good constitution written by Dr. B.R. Ambedkar. But in every day, we'll see the newspapers and news channels rape or natural disasters. This is called as trauma. Natural disasters, tsunami, earthquake, the war, COVID-19. Today, we are all discussing about COVID-19. The COVID-19 was started Wuhan city from China. From China moved to Spain, Italy, Germany, France, in America, and so on. When we are aware, when we were seen in the channels, news, where is the sensitivity in our country? Where is the precautions? Think about that. So when we see sudden shock, when we see sudden shock, that is called as trauma. The shock is coming from anywhere. That is called as trauma. And also, very beginning, when we experienced COVID-19, very few hospitals, few doctors, few beds, few nurses, very few psychotherapists, psychologists, physiotherapists in our country. And also beds are very less, ventilators also very less, oxygen also very less. People died. People are dying. It's a good experience for us. Today, Government of India, our respective states, acquire and recruit new doctors, more hospitals, more beds. And also, today we have more ventilators. It's a good experience for us. Some of the aged people were died. And also, very interesting thing, above 80, above 90, above 100 years aged people suffered with COVID, come back into normal, come back into normal. Just you have to think as a doctors. When the aged people coming back into normal, why not we? Means adolescents, adults died due to because of the COVID-19. Why they died? Aged people are come back into normal situation, coming into deprivation. That is called as denial. Deprivation means unavailability of something needed or desired. So here deprivation is there. So here, those who are having good social status and social class, they have very good hospitals, they're joined, they have very good medication and also medical support. So those who are not admitted in the hospital, when the beds are not available, some people who died outside the hospital, lack of beds, lack of the treatment, that is called as deprivation. See that. So here, the geriatrics speaks that medical care is more important and psychological care is more important for older adults. Here, the trauma is the response to a deeply distressing. They feel hopelessness. They feel the hopelessness. Majority of the people die due to cause of lack of psychological support, feeling of helplessness situations. The post-trauma symptoms, you see, post-trauma symptoms of aging people. The loss of control, betrayal, abuse of power, helplessness, pain, confusion, the loss. According to American Psychological Association, the post-COVID trauma, the trauma as an emotional response to a terrible event that is called it as COVID-19. Terrible event. The terrible event include physically and emotionally threatening or harmful. Number 3, psychological trauma. What do you mean psychological trauma? That is called as highly stressful situations. Some of the people having hospitals, ventilators, the medications, even though people who are died due to cause of the stress. And also some people suffered with the shock. So those who are involving into trauma, the long-term effects on the person's well-being. Once they're moving into trauma, definitely it affects on the person's well-being. Another interesting thing, trauma has developed to mental health disorders. We have a number of mental health disorders is there called post-traumatic stress disorder, PTSD. The types of trauma, acute trauma, that is called as a single or dangerous event. The dangerous event we call it as COVID-19. Coming into chronic trauma, repeated, and prolonged exposure to highly stressful events. The feelings, the thoughts is coming to the mind. Number 3, complex trauma. That is called as multiple traumatic events. The last one is secondary trauma. That is called as family members, mental health professionals. These are all very quite common in our respective families. Very beginning I told you, according to my research, rarely we see good wife and husbands. Majority of the wife and husbands keep on fighting each other. They are not believing each other. You will see rare love. You will see rare understanding. That is also a major factors influencing into the trauma. The professionals, trauma, there are a lot of variation in the hospitals. You'll see the difference between doctors, nurses, the psychiatrists, physiotherapists. So these are all the teamwork. The teamwork is more important. When they have professional jealousy, the longer it leads to the trauma also. The potential causes of the trauma means bullying, harassment, the physical, psychological, and sexual abuse. Today, there is also increase in sexual abuse, sexual assaults, sudden loss of loved one, kidnap, and natural disasters. So those who are under the trauma, post-COVID, and also today, WHO, ICMR, this week's third wave started in some countries. The third wave is coming in any time to in India. Be careful. So here, the post-COVID symptoms, physical symptoms, frequent headaches, digestive symptoms, change in appetite system, gastrointestinal problems, fatigue, racing heart, sweating in the body, feeling jump, difficult to sleep. You will not get good sleep. Nausea, dizziness. The sleep patterns will be changed. Coming into post-COVID, not only aging people, those who are crossed the 40s, and I have seen some of the students also suffering same problems. Emotional and psychological responses post-COVID. Emotional and psychological responses. One is denial, anger, shouting, or hitting himself, or hitting others. Fear. Difficult to coming outside. Difficult to eat the food. Suppose we want to going outside to buy vegetables or buy chicken. Any contaminated food selling outside, we have fear. Suppose as a wife, her husband, the working in any institute or in any hospital. I have seen some of the police officers in my clinic and some of the doctors, when they're coming from the hospitals, they leave their clothes and shoes outside and taking bath outside. They are not allowing into the home. And sometimes they're sending the food in outside. They eat food on outside and sleeping outside. They have the fear problems. The sadness. The child may die, the father died, mother may be died, a relative or a friend or colleague. So sad. We don't know what will be happening tomorrow. The shame or guilty, confusion, and anxiety levels are very high. The blood pressure levels are increasing. Heart beating is increasing. Depression. So when we are under depression, When you're not coping with depression, the depression leads to suicide. You may see in newspapers and TV channels, some of the people took suicide. And guilty consciousness. My wife or my father, my daddy was admitted in the hospitals. You are not allowed into the hospital. You are not taking the lunch to your father. The guilty consciousness and hopelessness. And also, some of the people, due because of emotional problems, they habituated taking substance abuse. And coming into post-COVID emotional problems, one is nightmares, insomnia, difficulty with relationships, emotional outburst, and also acute stress disorders. Acute stress disorders that we call it as panic attacks. Panic, I have seen a number of clients in my clinic. Panic attacks, suicidal thoughts, the feelings of being isolated. These are all emotional and psychological responses, my dear participants. Anxiety and loneliness, social isolation, PSD, risk factors, previous trauma, coming into pathological grief. What do you mean pathological grief post-COVID? Anger, guilty, self-blaming. Self-blaming. Why we are self-blaming? When I'm going outside, the COVID affected. When I affected COVID, when I'm coming back to home, from me, my children, my family members affected. Self-blaming. My dear friends, coming into today, majority of the people suffering with hypertension, diabetes, arthritis, dementia, Alzheimer's disease, the cancer, and so on. And so on. And health and wellness in late adulthood. More susceptible to infectious diseases. Our aging today, our aging society, the high incidence of illness such as cancer and heart diseases. The many researchers use the terms older, they called as aged, they called as older people, and sometimes elder interchangeably. So here, when we're talking about a national scenario, Games Association in developing countries, health and ageism, the sponsors the National Scenario Games, the largest multi-sport event in the world for people aged 50 and the older. More than 800 events, including cycling, swimming, pole vaulting, the tennis, track, and the field. 800 above events is there. My sincere appeal to Indian population. We also move into health and ageism is more important. How to live longer and better. How to live longer and better. In Andhra Pradesh, in some parts of the Andhra Pradesh, 108 years old age people are comfortably living without any medication. They themselves cooking and eating themselves. Why not we? Why not we? In Andhra Pradesh, in Telangana, in some parts of the country, people are living 108, 110. Why not we live 100 years, 108 years? The psychology speaks how to live longer and better. One is exercise physically. Exercise physically. It increases blood, oxygen flow to the brain. Oxygen flow to the brain, which cleans the body of impurities and decreases the risk of diseases and death. Oxygen blood flow going to each and every organ in the body. Brain cleanliness. And every neurological system effectively functioning. Once it's effectively functioning, decreases the risk of disease and also decreases death rate. Exercise mentally. This is very, very important. What do you mean mentally? You can keep your brain fit by engaging in behaviors. Good behavior. Good attitude. Be friend. Be smile. Be open. Accept any criticism from others and learning. That increases thinking, such as playing board games at home, playing musical instruments, doing crossword puzzles and reading. We have wonderful books is available. Read at home. Go to the library and read. It's good for brain. Coming into lose weight and don't smoke. Smoking and obesity are linked to diabetes, heart diseases, some cancers and arthritis. So please avoid to smoke. Quit smoking is very important. What you eat, this is very important. Eating a diet includes good vegetables, good fruits, good grains, nuts, and also not to eat 100%. In every time, 25 to 30%, you have to avoid the food. Only 75% you have to fill. That's 25%, the gap is more important in the stomach. Not to eat 100%. Control your blood pressure and avoid diabetes. High BP increases the chances of stroke, heart attack, and kidney failures. Diabetes, which affects every organ in the body, can cause blindness and kidney and heart failure. And the last important point, establish strong social networks. We need good friends. The social relationships is more important. These social relationships reduces the stress, anxiety, and depression. The next important point, setting concrete goals. Short-term goal and long-term goal is more important. Whatever you have the long-term goal, the long-term goal you have to keep in our pocket. You work for short-term goal systematically. when it's systematically, with your interest, with your satisfaction, successfully completed, short-term goal, definitely you will reach your long-term goal. So what is the role of the psychologist in relation to elderly patients? Role of psychologists in relation to elder patients. Psychologists assist older adults and their families with advanced care planning. Advanced care and the planning. They counsel, individual counseling, couple counseling, the family counseling, not only counseling. We have a number of psychological interventions there. They counsel terminal ill patients and their families on how to manage feelings, how to manage the feelings. The third wave. When the children are away from the home, the children were settled in America or UK. And every parent is expecting psychological support from the children. The children always says that I'm not able to come to India, very difficult to come. If you want money, or 1 lakh, 2 lakhs, or 3 lakhs, I will send to you. You can engage servant maid or nurse. But money is not giving happiness to the elder parents or older parents. They want psychological touch rather than money. So the psychologist, through psychological interventions, decreasing distress, managing the pain, and after the death and the grief. Therapies for trauma, the safe and sound protocol. Dr. Stephen Porges, SSP, uses auditory system, and its direct connection to the nervous system, to restore the brain and body's ability to final states of the calm, safety, and regulation. Coming into CBT is very interesting. Cognitive behavior therapy. This cognitive behavior therapy helps people to change their thoughts, change their thoughts, the thought patterns, in order to influence their behaviors, and their emotions. CBT as effective approach for post-traumatic stress disorders. The eye movement desensitization technique is there. Eye movement desensitization and the reprocessing technique. EMDR is an effective treatment for PSD. And we have a number of therapies is there. Apart from that, medication is also available. Only medication won't help for any diseases. Medications as well as the psychological support is more important to control, to decrease physiological or psychological diseases. When the decreases are controlled, the quality of life is increasing. Only medication won't help. So here is a team of work, in the hospitals like doctors, the nurses, the physiotherapists, and other specialists. Not only that, if you go to the Western countries, many patient coming, normally doctors recommending, or some of the people directly go to the psychologists. Then they come to the doctors. In the Western countries, when the older people going to the surgery, first they treat the psychologist and they're giving the counseling and psychological interventions to develop positive attitude towards the disease or surgery, and also psychological counseling or intervention helping for the acceptance. After surgery, they're coming back into normal situation. How families cope. Some families are brought closer together as a result of their open expression of feelings. It's very, very important. Till today, majority of the people not expressing their feelings openly, not opening their feelings in front of their husband, their wife. Even children are also not expressing their feelings to the parents. Even institutions also, the subordinates is not expressing their feelings towards his boss. Why they are not expressed? Because of belief system. The belief system suppressing their openness, their feelings. The character of family adjustment prior to the illness can be a very important factor in post-illness coping. Number 3, psychoeducational care for patients with a variety of chronic diseases. Psychoeducational programs not only provide chronically ill patients with information, but they also use a variety of approaches to help patients and their families cope. Families cope. Care by the family. Care by family. Self-care activities such as dressing, going to the bathroom, bathing, and eating. It's very, very important. The many families do take care of their helpless elder persons as long as they can do so. The caregiver's ability to provide assistance. Not only caregivers, wherever you see the elder people, older people, the children, grandchildren, the care, the support, and time availability, spending the time, psychological touch, physical touch is very, very important. The social support provided to the caregiver can help to counteract the ill effects associated with providing care. The role of emotions in healing. We are coming to the end. Okay? The role of emotions in healing. The emotions that attend serious illness can be complicated and rectified. Many patients feel that they are losing control and they experience self-blaming, a sense of failure, anxiety, apprehensions, and confusion. A patient is maintaining emotional equilibrium. Several studies have emphasized the central role of maintaining emotional balance in coping stressful with illness and injury, according to Cohen and Lazarus. Low psychological morale is thought directly to affect physiological processing in deleterious ways. Before closing my lecture, my dear participants, my dear doctors, my sincere appeal to the participants, maintain the good family relations, the good understanding, the good transparency, the positive attitude, be openness, human touch, physical touch, be smile. Respect family members and your children. Be smile with your patients, your friends, very, very essential. Your children learn how to care from tomorrow. They take care of. See here, when you're taking care of parents, taking care of your parents, when you are giving glass of water to the parents, when you're clearing their lunch plate or bowl, the children learn. When you love your parents, your children also love you. When you're taking your parents outside, your children learn from you. When you're showing psychological support and social support, when you're giving comfort, when you're giving happiness, your children learn. And tomorrow, your children also treat in the same way. When you are not treating properly your parents, tomorrow, your children also not giving glass of water to you. This is very, very important for us. Money is important for medical care, but elder parents accepting psychological support and love and touch from their children. Money is a temporary. Money is temporary. Money is important, but psychological care, psychological support is more important. Okay, this is my conclusions. These are all my conclusions, my dear friends. Thank you, one and all, for patiently listening my lecture. You have any doubts or any clarifications? Please open for discussions. Thank you.
Thank you so much. Thank you so much, Raju sir. That's a wonderful and very more meaningful webinar in the recent times. Money can buy many things, but definitely it can't buy parents' love and blessings. That is the exact conclusion of whatever you said. And there are many wonderful points that you have touched, like the psychological aspect. It has to start at home, where parents should open up with each other, children should open up with each other, which is an excellent point, because the rise of the nuclear families is the social distancing started way before, I guess, way before COVID started. Social distancing started between many families, many people. And there is one more point which you said, sir, how much you want, tell us, we'll send it from America. I have seen many patients, many elders. When I took my father to a hospital, I want to tell this because I took him for a cardiac test to a very big hospital, and I was just sweating like hell because I don't know what will happen to him. But then in front of my father, there is a millionaire sitting in a chair all by alone. He was in a wheelchair. So the nurse came to him and said, sir, it's a very important surgery that you're going into, so please at least bring one guardian, at least one of your children, whoever it is, ask them to come or ask them to call. All he said was, they are ready to pay for my surgery, but they are not ready to come here to look after me, which is very, very, very pathetic state that we are living in. And that needs to change a lot, because, and also at the last, what you said, whatever we do to our parents, tomorrow our children will do the same to us. They grow looking at us. They grow old looking how we are looking after our parents. So this is a wonderful eye opener to everyone who is listening to this. Love your parents when they are alive, not just when they are expired. Don't just keep condolence meetings saying they did all this to us. No, just treat them well, love them well. All they need is your time and your patience. That's it. Thank you so much, Raju sir, for touching a wonderful, wonderful topic, and it's very close to my heart. And from the bottom of my heart, I need to thank Jay Prabha ma'am for bringing such a wonderful speaker. Thank you so much, ma'am. And all over to Dr. Deepti, who will close this with the word of thanks. And once again, thank you so much, Raju sir. This is a wonderful topic. Thank you so much. Deepti, all over to you, ma.
Yes, ma'am.
Yeah, Deepti, go ahead.
Thank you so much, sir. That was very wonderful session by Dr. M.V.R.Raju, sir. It was very informative. it's for sure is the need of us because the elders have been suffering a lot during COVID times, both physically and mentally and emotionally. Thank you so much, sir, for being a part of us in the webinar and also for giving us your valuable time and knowledge. It's our pleasure to have a wonderful and experienced person like you, sir. My heartfelt thanks to each and every person over here, and I'm very happy and honorable to be the part of IAP WBCAP team. I would like to thank the president of IAP, Dr. Sanjeev J. sir, and national head Dr. Ruchi Vaishni ma'am, and IAP WBC zonal head Dr. MC Jayprabha ma'am, our IAP WBC AP state coordinator Dr. Priyalni ma'am, and my big cheers to IAP WBC AP team. And last but not least, my special thanks to our IAP technical team. Dr. Alope and Manisha ma'am for supporting us all at the time of whenever we conduct the webinars. I would like to thank all the participants for attending this session and making event successful. And don't forget to subscribe our channel, IAP India YouTube channel. Thank you so much, sir.
Thank
Thank you.
Thanks a lot, Dr. Deepthi. And